Hello, welcome to this short where we're talking about Cheyne Stokes respirations. A respiratory pattern that's characterized by a gradual increase in respiratory rate, depth, quality, and then a decrease in respiratory rate, depth, quality, and then a period of apnea, and then the pattern will repeat. This is going to be something that you may see in your congestive heart failure patients, as well as patients who are neurologically compromised. Specifically, I'm thinking of strokes and traumatic brain injuries. So we've said what Cheyne Stokes is, what the pattern looks like and who you might see it in, but why are we seeing it? What's going on? So I want to start with the concept of homeostasis. So say our body experiences a stimulus outside of that normal range. It tries to do things to correct it and get back to that warm spot, that comfortable spot. Well, this happens with our brain responding to levels of carbon dioxide in our body. So we have this area in our brain called the medulla, and it has these things called chemoreceptors. And those chemoreceptors, what they're responsible for doing is they're analyzing the chemical components of our blood and seeing, is this normal, or are these supposed to be here, and are they in the right ranges, and is there any adjustments we need to make on our part to try to get us in those right ranges? Again, homeostasis, your body likes it. It is the natural flow of our body. And so if you have high levels of carbon dioxide, your body does something about that. It makes adjustments. And I'm sure you're aware of this concept, but we'll go over it really quick. So I have high levels of carbon dioxide. It's going to say, whoa, let's pick up that respiratory rate. Let's get rid of some of this excess carbon dioxide. And so you do. You breathe quicker, you breathe deeper. That's what you see clinically with this patient sometimes. Let's flip that and say you have a low carbon dioxide. Well, your body will say, hey, let's slow down our respiratory rate. Let's hold on to some of that carbon dioxide. Let's get it back to that sweet spot, that homeostasis region that we like to live in. So take that concept, and what I want you to think about is the brain is just interpreting information. And so you either A, have a problem interpreting that information. So that's why I talked about that neurological compromise. You have a stroke or a high intracranial pressure, and it's inhibiting the brain's ability to perceive that information and what to do with it, and you might lead to abnormal respiratory patterns like Cheyne Stokes. But we also talked about congestive heart failure. So why are we seeing it there? That's kind of random, isn't it? It is until you kind of think about another side. So say the brain's ability to interpret information there's nothing wrong with it, but maybe the information is askew. Maybe that's not accurate. And so with congestive heart failure, we have a steady, low cardiac output, meaning that the blood and the chemical components that the brain will react to are circulating, but at a much slower pace. And due to that slow pace, when the brain is picking up on that information, it might not be reflecting what the rest of the body is experiencing. So meaning, if the medulla is getting intel that the carbon dioxide levels are here, but the body is slowly circulating the message just hasn't got to it yet, well, meaning that level might not be accurate. And so you kind of have this the seesaw kind of thing going on here. Give you an analogy. Say you're having hot water, your water heater issues, and maybe you got a new one, or it's getting older, and you've been facing some issues, so you've been making some adjustments, trying to figure it out, and you go to turn that faucet on, or your shower, or whatever it is, and you have a hard time finding that sweet spot of where the water is comfortable to deal with whatever you're trying to do. Okay, I turn the faucet one way, and it gets way too hot, and then I do it way the other way because that was way too hot. I need it to cool down really quick. That's burning me. And then you get way too cold, and you kind of go in this oscillating pattern of having a hard time making the correct adjustment. It's not too unlike this respiratory pattern of Cheyne Stokes. So I have a delay in information being circulated in my blood due to low flow cardiac output of congestive heart failure. So that message is old, and it says, hey, carbon dioxide's high, start breathing quick. So your body starts breathing really quick. But as a result, you're eliminating excess carbon dioxide that you might not need to get rid of. It's not necessarily an accurate number, and so your body is working off of bad intelligence, for lack of a better term, and overcompensates. And so then your body overcompensates the other way. And it says, okay, whoa. We got rid of too much carbon dioxide. We were breathing too quick. Let's slow our breathing down. Let's slow it down. Okay, let's go the other way. But then, well, you have the opposite problem. And so then carbon dioxide builds. Key part I didn't mention here is the apnea. So you can actually, in Cheyne Stokes, what you're seeing is you are reducing the perceived values of carbon dioxide so low that your body then overcorrects to the point of apnea. It says stop breathing altogether. And as you're doing this, though, carbon dioxide builds and the pattern repeats itself. I hope this concept makes sense. If you guys have any questions or want to talk about Cheyne Stokes, I would love to have the conversation with you. And thank you for your time and listening.